understanding the Pentacam ABCD Ectasia progression display. So we do not look for progression by just comparing anterior curvatures from two different maps on topography anymore. The ABCD progression display is much more sensitive for picking up progression than just looking at Kmax or central corneal thickness. Those techniques or those ways of looking for progression belong in the Dark Ages. So what is the ABCD progression criteria? The letters stand for A is the anterior radius of curvature on the front surface of the cornea within a 3 mm optical zone centered on the thinnest point of the cornea. B is the same on the back or posterior surface of the cornea. C is the central corneal thickness. And D is the distance best corrected visual acuity. Obviously, this needs to be entered manually into the platform for it to factor into the equation. So the whole system here works on a series of 3 gates: the green gates, which determine the normal population, the red gates for the keratoconus population, and the blue gates, which are for 12 months post-cross-linking. I am not covering those. This is an introductory video. The blue gates get a little bit more complex. They can confuse you, and to be honest, progression after cross-linking is so rare these days that I don't think we need to cover that in a simple, basic introduction video. So what do the green gates mean? This is the normal population. So you can have an 80 to 95% confidence interval that if the parameters that the ectasia display is giving you are within the green flags, that you have a patient with a normal eye. Now you'll see here that for the A, B, C, and D criteria, you are given a bar graph, essentially a horizontal graph with the scans that you have taken, and the scans will be in the appropriate flagged zone. Now, in this scan, you can see that the green flags then transition into the red flags. So in this one, the distinction is really clear and really easy between the normal and keratoconus population, but it is not always that way. So you'll see in this image that the normal patient population and the keratoconus patient population have a significant crossover. This isn't confusing or alarming. It simply means that sometimes some parameters on a scan may be abnormal in one patient, but in the normal range for another patient. And obviously, that depends on another number of complex factors. So what do the red flags mean? They are, of course, the keratoconus population. So now let's look at what it means to determine if there is genuine progression using the ABCD progression criteria. So what constitutes progression? So if any of the parameters A, B, C, or D move from the normal population into the keratoconus population, if 2 of these parameters move above the 80% confidence interval, then that is considered progression. If one of the parameters moves from normal into the 95% confidence interval, then that alone, without a change in any of the other parameters, is evidence of progression. Be sensible, of course, still exercise judgment. For example, don't just go on the distance visual acuity. If there is no change in any of the other parameters and the topography is exactly the same, you may need to look for cataract or a poor refraction as an example of the cause of reduced visual acuity, not using that parameter alone. So let's have a look at one that is not progression. So looking at this in the A criteria, there's no significant change. Yes, the graph moves from the normal population still into the normal population. No progression on A. B is exactly the same, obviously. There's no progression there. Now in C, in the thinnest location of the cornea, our second scan, performed on the 17th of the 2nd, 2025, has moved from the 80% normal flag into the keratoconus 80% normal flag. Now, you would need this to happen in either A or B or D as well as C to consider this to be progression. Personally, if this just happened in C and D, I would be cautious. This is where I would exercise judgment, as a refraction can sometimes fluctuate. Best corrected visions can fluctuate. But certainly, if you had this same change in criteria A or B, then I would consider that evidence of significant progression. So let's look at a case where there is genuine progression now. Now look at this topography. There is no significant change in the anterior sagittal curvature on this eye. If you looked at that, yes, there's some subtle steepening there, but nothing over a diopter, nothing that anybody would call significant progression on a straight comparison map. Now, let's look at the ABC progression criteria for the same eye. So let's look at A. For the scan on the 25th of the 11th, 2024, well within the normal range. But the second scan, the green bar graph in the A criteria, has moved well up into the keratoconus range just. So it's just moved into that keratoconus range. Looking at B, for the posterior surface of the cornea, there's been a very significant change, with that green bar moving well into the keratoconus 95% flag. So that alone qualifies for progression. But we've got an 80% confidence interval progression on A. We have a 95% confidence interval progression on B. So the B alone is enough to justify progression. Then C, looking at central corneal thickness, we have moved into the keratoconus 80% population. So just A and C alone are enough to document progression. B by itself, or A and C combined, are enough to document progression. B is adequate by itself. This patient has significant progression of their keratoconus, but comparing it on those topographic maps, that would not have been detected. One last one here. Is this one progressing? It's a good question. So let's look at A. A, the second bar graph, has just moved into the keratoconus 80%. Again, you might exercise caution here. It's only just tipping over into that keratoconus population. B, we've got a progression right up into the 95% confidence interval for keratoconus, so obviously that is significant in itself. And then C, we have a progression right up adjacent to the keratoconus 95% confidence interval. So in this case, the patient has progressed on both A, B, and C. We have a significant case of progression. I'll try and do more videos on the ABCD progression criteria. This one is introductory. Don't be overwhelmed by this criteria. Remember, it does not apply for 12 months after cross-linking. You need to manually insert when patients have cross-linking. But again, I haven't covered that in this video. I'm just trying to document how to use this display to detect progression in your patients with keratoconus. I hope you found it useful.